Let's just talk about getting a new joint because in my practice now, that's a big part of what we do. Ortho, ortho, ortho. Mostly knees, hips, and the occasional shoulder. What can you expect? Let's start with the shoulder because that's a little bit different. Um, it can be different for different patients. So when your neighbor says, well, what happened with mine was, you don't know yours is going to be anything like that. It's partly because of how the shoulder joint is built, and it is held together with the rotator cuff, all these different muscles and tendons and ligaments. And so when the surgeon goes in, they're going in like a tailor, and they are cleaning up frayed bits and sewing together what they can. Some people, it's more simple, and some people have had lots of injuries and maybe other surgeries, and there's scar tissue, and it's harder for the surgeon to do what they do. Also, I find a greater difference in the surgeons, and some are more conservative. So when it comes to the shoulder, I do what the surgeon tells me to do. And they should send you home with a beginner the first couple weeks of what they want you to do, what you are not allowed to do. It is not a time for strengthening. Maybe just getting the joint moving a little bit without working, because you need to keep your range of motion in the shoulder. You need to keep things moving without straining the joint. Um, because something just went out of, oh yeah, it'll tell you. I think most of their paperwork is terrible that they send out, and it's rarely designed by an occupational therapist, so it can be confusing on what they're saying to do, and some of it can sound way too technical for you, so don't worry about that. You should have a therapist. It could be OT and it could be PT coming to the house to work all that out for you. They might say to do these hand exercises. I don't like to think of them as exercises. If you are not moving your shoulder, people can get what I call the Tin Man effect, and then they stop moving everything. So the doctor wants you to keep moving your hand. Don't think of them as exercise. Just think of them as keep moving. Okay? And then your therapist will take over from there. Hip surgery, there are two different ways to do this surgery. And the one way, you will have hip precautions for about 6 weeks. There's no getting out of it. I had a patient who said, well, I'm going to be seeing the doctor next week. I think he's going to tell me I don't need these precautions. There is no time off for good behavior. It's how the body works. That's it. Hip precautions, they should make this very clear to you before you leave the hospital. Sometimes they don't. It's a lot. You're on pain meds and they kick you out of the hospital so fast, and there's all this stuff. And no bending, lifting, or twisting, which we call the BLTs. No bending, lifting, or twisting. So your hip should be at a 90-degree angle. It's not just that you're not lifting the leg up, you're bending over. Lift up? No. So stepping into the shower, lifting that leg? No. Bending over to get the remote that fell to the floor? No. The grabber, the reacher, is going to be your friend. Okay? Some people get the hip kit. A hip kit has the equipment that you're supposed to need. This isn't the video to go in depth on what all of those things are, but it's things to help you get dressed. Things to keep you from bending over. Some things are worth it, some things aren't worth it, some things you can get at the dollar store. Yeah, 6 weeks is a long time, so it can be worth getting those items in the hip kit. You might have someone in the house who is willing to put on your socks, but 6 weeks is a long time. And by week 4, that person might be saying, well, I want to go out here at 7 o'clock in the morning before you get up. And then the knee. Knees progress pretty quickly, right? You're up and walking right away, as with the hip. People, when they come home, again, people get kicked out of the hospital, in my opinion, too fast these days. So that first night at home, people can be kind of miserable. And it is very hard for them to imagine that in 4 days they are going to be so different from how they're feeling that day. But it's usually true. I worked in an area where people were across the board sicker, for a number of reasons. Poor healthcare across the lifespan, pollution, blue collar jobs that kind of killed their joints, factory work or machine work or something like that, so that as they got older, they already had problems in some of their joints, food deserts, things like that. And I might see somebody for a couple weeks if they had a new knee because they had hardly been moving before and they live in their recliner and maybe they had COPD and diabetes and some other things. My general population now is healthier. I try to do, with all of the joints, I try to do my first revisit as much as I can at the time of the evaluation because people need that information as soon as they can get it. Why come back days later and people have been suffering trying to figure out how to get on the toilet or something like that? Um, Ice, yes, they're going to tell you to ice. Therapists love a bag of peas. Some things get colder than other things. Some things hold the cold longer than other things. A bag of peas, just mark it so no one will eat it. And you can, if it's your shoulder, you can do here and then here. You can move it all around. 20 minutes max, maybe 10. And you're going to protect your skin, which the hospital, they should discuss with you and your therapist should discuss with you. Make sure you're protecting the skin from what would basically be like frostbite or freezer burn. But you also have to check that the skin is turning cold. Some towels that you use might keep the cold from getting through. So they're going to instruct you on how to use ice. Most people are told to use ice. Most people for the legs are given compression stockings. Not everybody these days. You'll have a nursing visit. It's usually the nurse. If there's a nurse on the case, it would be a nurse who opens the case and has you sign all the forms and the permission things and the legal things, and going over all your medication and putting that into our system. The physical therapist for your knee and your hip, that's going to be your main person. And I'm going to try to get you squared away and safe as quickly as I can. And I'll see you however long you need me to. You might not have a lot of nursing visits. There is a surgeon in our area, an ortho, who doesn't assign a nurse to the case. PT and OT. Because they're putting a bandage on and no one's allowed to touch the bandage. So the nurse is going to come out and just look at your bandage. You might have other things going on and you might need more nursing visits, but people think, oh, I need a nurse, I need a nurse, I need a nurse. Why isn't the nurse here? Well, in this case, there's not that much for the nurse to do if you are otherwise completely healthy. And I hope you are. That's it. In our company, we're all coming out on the same day if we can. That's the goal. That's what the doctors want, and that's what we try to do. So it's very hard. It's a lot of people calling when you're not in the mood. And it's 3 medical visits in one day when you're not in the mood and your pain is really high. Let us come out and help you. It might be the next day, but we're going to try to do what we can do. Okay? Yeah, the therapists, so they'll take over from there about the equipment that you need, how to get the equipment that you need, what you qualify for, all of that stuff, what exercises you should be doing. So that's just a very broad intro into the 3 main joints that we see in home health. Okay.